Hello, YouTube. I had to make this video before before I uploaded the second part to the teleportation video. I'm sorry I haven't got that up yet, but I just had to get this one out there first. Um, it takes me, my upload speeds are horrible where I'm at, and I have like top of the line um internet bandwidth, and still upload is just awful. So it takes me forever to get like a 1 hour video takes me all day, like all afternoon to get it uploaded. But s anyway, um, this video is gonna be a rant video. Um, I am a sufferer of chronic pain. I had an accident back in uh, the early 2000s, and it left me in pain. Um, over the years, it's just progressively gotten worse and worse and worse. And I've been okay, stable. Um, you know, on the medications that I have, and work great, and there is no problem. Uh, this opioid crisis that is so prevalent right now is being caused not by prescription pain medication, but by heroin, and specifically heroin mixed with fentanyl that has hit the streets and started killing people left and right. The reason for that is because it's so strong, and the ability to get on the dark web and use Bitcoin or an anonymous currency to buy extremely strong opiates cut like fentanyl, um, from China or wherever, Russia, whoever, wherever you want to get it from, they're getting it, and they're getting it by the bucket, and it's extremely cheap, and they use it to cut the heroin, and they sell it for heroin prices, and it's extremely lucrative. I mean, they are making it hand over freaking fist because of this, and that's why it's not stopping, because there's so much money involved with it. But on the other hand, it's made the potency of the opiate of heroin go through the roof. People don't understand fentanyl. They don't know what it is. They don't, they go and cop a bag of heroin thinking that's what they've got, and they don't guinea pig it, they don't test it. They go with their regular dose of, say they were getting heroin all this time, they go with their regular dose that would normally be heroin, which when you use fentanyl with that same amount, it stops your breathing. It puts you out. It's so strong. You don't have a tolerance for the stuff. I mean, even some of the veteran heroin addicts that are out there been killed, died because of fentanyl, because it is so strong. Well, there's a couple of reasons I think um, that. Well, I'll say this, okay? It's gotten completely out of hand now. The government has tried to um, wage war, I guess is the best way to put it, on this opioid crisis, trying to fix the problem, because it is a problem, but they're going about it completely, completely the wrong way. They think, because the only thing that they can do, the only thing that they can control to um, fix the issue is preventing doctors from prescribing opiates. They think that if they shut off the supply that way, that the numbers will fall, the amount of deaths will drop, there will be less opiate addicts. It will remedy the situation. If it doesn't remedy the situation, it will at least cut off. It'll make the numbers look better on paper. We'll say that, because even though the amount of heroin overdoses is the same, they cut off the prescription pain medicine side. The numbers are going to fall. Well, this is not going to work, because the prescription pain meds aren't killing people. They've been there forever. What's killing people is heroin, and strong heroin. That's what's killing people. And what's killing people is their doctor being closed down, their access to their medication being cut off or stifled, and they substitute with heroin and die, or like it better than, or get more relief for their pain with it rather than the prescriptions, and then they're on the road that way. They're never, ever, ever, ever going to get rid of opiates and people being addicted to opiates. It's never going to happen. They've been fighting this war way thousands of years back. The Chinese, opium dens, where they were bringing it over here. There was wars. There was wars fought in the name of lots of other things that were actually fought over opium and opium trade. It's just one of those things that's never going to go away. And unfortunately, the people that are suffering right now in this war are the people that really need the opiates for medical issues, and are being categorized, profiled, and put in with the abusers of the opiates, and the people that aren't using them for medical issues. They just are lumping everybody all together and cutting it off at the knees. And they see so many, they can't tell who's who and what's what. They don't have the time to vet anybody, so they're just gonna cut everybody down. And as long as the numbers look good on paper, who cares if the cancer patients are suffering? Who cares if suicide rates are going through the roof because people would rather die than live with the pain that they're having to suffer? Who cares if quality of life for these people that were using opiates to give them the ability to get back into a normal routine and a normal activity? Um, who cares if people are depressed and um, they don't care, as long as the numbers look good. Less addictions, or less addictions being reported, less deaths, less overdoses. Once they start seeing that, but what's happened is the deaths have not decreased. And if you look at the numbers, you're not going to find a lot of statistics from 2018, 2017. You can find 2017, but it's hard to find a death tolls, like how many people have overdosed on opiates in 2017. Because what I did find was it's increased. It's still increasing. The numbers are going up. It's not working. Okay, they keep shutting doctors down. They keep limiting the amount of opiates that the doctors can prescribe, but the death toll rises and the addiction rate rises. It's not working. So, what do? Well, they overreact. Opiate. Does opioid use in pets create higher risk for abuse in humans? They're just grasping at straws right now. So, um, so they've cut off, decreased, stifled the amount of opiates that humans have access to, and that didn't work. So what else? So the pets, okay? The increase in opioid prescriptions for people over the past decade may have been paralleled by an increase in opioid prescriptions for pets. According to a study from researchers at the University of Pennsylvania, the findings in the first ever study of veterinary opioid prescriptions suggest that there is also an increased demand for veterinary opioids, driven by complex procedures performed in veterinary medicine as well as a heightened awareness of the importance of pain management. They're going to start taking your pet's pain medicine away. They don't they think that you're abusing your pet's pain medicine, and that might fix it. Okay, so we've got your pain medicine lowered. So where are you getting it at? You're getting it from Fido. Fido's pain medicine gone. About to take it. Okay? Also, let me see if I can find the other article about dental dentists, not medical doctors, but where is it at? Where is it at? Sorry, I should have. Okay, here we go. Opioid prescriptions from dentists linked to youth addiction risks. Okay, so why are we talking about teens and opiate addiction? Well, I don't know. Why are we? Teens and young adults who receive their initial opioid prescriptions from their dentist or oral surgeons are at increased risk for opioid addiction in the following year. A study from the Stanford University School of Medicine found that opioid use and abuse in a large group of privately insured patients from across the United States among nearly 15,000 young people who received initial prescriptions from their dentist in 2015, 6.8% had additional opioids prescribed within 90 to 365 days later, and 5.8% were diagnosed with opioid abuse during the year after the initial prescription. 5.8%. Okay. Now that sounds like it's very horrible, like bad and a big deal here. Okay. But first of all, if you go and you have tooth pain, braces put on, appliances put in your mouth, everybody knows dental pain is horrible. It hurts. It hurts afterward. It hurts for days, weeks afterward, sometimes, depending on what you have done. Okay? So, the way they say 6.8%, now this is 6.8% of 100%. Okay? That that's what they say. This is actually a very, very small number. Okay? But they make it sound like a really big number by the way they word it. And 6.8% had been prescribed additional opiates between 90 and 365 days later. Okay, well, that means that they had probably a follow-up procedure done that required them to have another prescription because it was painful. Something else happened that was painful, which this is normal. I mean, this is a completely normal number that they're trying to mock up and make it, they're fear mongering. They're fear mongering opiates. Okay. They're doing exactly what they did back when reefer madness hit. This is the new marijuana. Marijuana is about to be legalized nationwide. Their jails are going to be empty. Okay? There's no more of that marijuana arrest money coming in. So they need a substitute drug that they can demonize and fearmonger and use to supplement the loss of the marijuana criminals. Okay? That's why this is such an outrageous thing that's being shoved down everybody's throat and made to be the scariest epidemic ever. But it's really not. Okay? There's nothing really changed. The amount of opiate deaths are going up specifically because it's easier to get extremely strong opiates on the internet from other countries and places. The availability of strong opiates on the black market has increased. That's why the amount of opiate deaths has gone up and addiction has gone up. Availability to strong and exotic drugs on the internet is the reason we have an epidemic. It's not prescriptions. It's not the doctors writing prescriptions. All this has done is made a lot of people suffer for no good reason. And it's sickening. It's sadistic. Okay, they are okay. Let's go on to the next one here. This one really got under my skin because I know how painful this one is. Let me see. Where'd you go? Where'd you go? Where'd you go? This one. Unwise opioids for wisdom teeth. Study shows link to long-term use in teens and young adults. Okay, so they're making it, they're saying getting wisdom teeth removed may be a rite of passage for many teens and young adults, but the opioid painkiller prescriptions that many of them receive could set them on a path to long-term opioid use, a new study finds. Young people ages 13 to 30, see, they're going after the children now. That's how they scare you, the parents. They're scaring the shit out of the parents because their kids are going to be junkies after they get their wisdom teeth out and they get that Loricet prescription. After that, they're going to be banging heroin in the bathroom like Ray Charles. You know, they're going to be knotted out and dead from a fentanyl overdose after they take that Loratab for their excruciatingly painful wisdom tooth extraction. You know, 13 to 30 who filled an opioid prescription immediately before or after they had their wisdom teeth out were nearly 2.7 times as likely as their peers to still be filling opioid prescriptions weeks or months later, according to new research. Okay, let's evaluate this statement here. Okay, they are 2.7 times as likely as their peers to be filling prescriptions. So you're saying that people that have their wisdom teeth cut out are 2.7 times as likely as their peers to be filling opioid prescriptions weeks or months later. Well, of all of the 100% of people that have wisdom teeth cut out, 2.7, a percentage of those people are going to have complications. They are going to have additional um, orthodontal surgery. They're going to have um, things that require further pain medicine, further treatment of pain. There's nothing weird or nefarious about that, but they're trying to fearmonger, and that that's something that people should be paying attention to. Why are they making this opiate epidemic crisis so more than it needs to be? I mean, let's get back to reality, okay? And get away from the fear and actually start thinking with our brain, using some common sense and asking questions like, why are you trying to scare parents about their kids getting a pain pill prescription after they have surgery in their mouth? I mean, they are literally saying in this article that wisdom tooth extraction is performed. Just listen. Wisdom tooth extraction is performed 3.5 million times a year in the United States. As many dentists routinely prescribe. Okay, 3.5 million times a year in the United States. Okay, and many dentists routinely prescribe opioids in case patients need it for post-procedure pain. Okay? Until now, we haven't had data on the long-term risks of opioid use after wisdom tooth extraction. We now see that a sizable number go on to fill opioid prescriptions long after we would expect they would need for recovery. And the main predictor of persistent use is whether or not they fill that initial prescription. Okay, this this is just, I can't even like get the words to describe how angry this makes me, because they are pushing dentists now. Things like this propaganda will cause a wave of fear in the mainstream that will push dentists to start making people suffer unnecessarily because they're scared that after surgery they're going to take a pain pill that's going to turn them into a raving junkie with needles hanging out of their arm, or dying from an overdose of heroin, which is ridiculous. Absolutely freaking ridiculous. And they're playing this fear up. They're saying here that we should look to alternatives of um, of dealing with the pain. Dentists should look for alternatives rather than prescribing something as small and simple as a Loricet Plus for pain after having dental surgery, your freaking wisdom teeth cut out. We should look at like maybe giving them an aspirin and telling them to walk it off, rub a little dirt in it. That's what they need to do. Just, uh, just after you get them wisdom teeth cut out, you know, we don't want to give you any kind of pain relief medicine because you'll become a junkie and overdose and die. So you just need to walk it off, go for a jog, um, get a get a hot shower, and then I don't know, lift some weights or something like that. You'll feel better. You'll get through it. Instead of reasonably like taking something to relieve your pain, just suffer through it because you don't want to take that absolutely astronomically small chance that you'll become a junkie after taking a pain pill. I mean, this is so gotten so crazily out of hand. And I'm telling you, the reason for it is so they can supplement this for the marijuana that's becoming legal. This is the new demon drug. It used to be pot, now it's going to be opiates. And in Alabama, right now, if you were arrested with a pill, a prescription pill, that you don't have a prescription for, it is an automatic felony. Every pill you have is a felony. Okay, listen to this. A felony. If you have a bottle of, say your wife gives you a couple of Ambiens to take on a business trip. It's her prescription, it's not yours. You have them in your pocket. You bored, you just don't even think about it. You're going somewhere, something, and you get searched by a police officer for some reason, and they find these two Ambiens on you. You just got 2 felonies if you're in Alabama. 2 felonies, okay? On felonies. If you get busted with a couple of Lortabs, you've got felony charges for each one of these pills. Okay, that is the most extreme. If you have a 3-strike law and you get busted with 3 Lortabs, you could actually do life in prison for having a couple of pain pills that you don't have a prescription for. Okay, that is beyond insane. Okay, you you can't. It's a drug, and it needs to be controlled, but it needs to be controlled by doctors, not legislators. Okay, they don't know shit about treating pain or the patients. Okay, if they want to fix the opiate crisis, they need to start with federal marshals monitoring the mail, okay? UPS and the Postal Service and people buying illicit opiates on the internet by the bulk and then turning around and selling them on the street that's killing people. That's the issue, okay? But they're using this for a lot of different things. That's one of them, to make up uh, the criminal component that they're missing by marijuana becoming legal. The other one is, where'd she go? Where'd she go? Where'd she go? Nope, that's not it. That's not it. That's not it. Oh, where are you at? Dang it, I'm sorry. I should have had that ready to go. Me, what it is here we go. Sorry about that. This is it. Trump's wall won't do anything about opioid epidemic, okay? Trump claims his wall will stop the flow of heroin and other illegal drugs from Mexico. He's wrong. This opioid crisis, this big play up about how bad opioids are and how it's killing everybody, this is a political push, okay? They want to fearmonger the opiate They want to get it in everybody's mind and make sure everybody knows that heroin is killing the population. Opiates are turning your children into junkies. We've got to build the wall. The wall will stop the heroin. The wall will fix the opioid crisis. You see how this works? This is called political propaganda, and it is being played out right now. And the sufferers of this are people that need medical treatment using opioid therapy. And those people are dying of cancer. They have been in trauma, in and are in pain. They're suffering. They are literally suffering people, and they are being treated like criminals, drug addicts, and they are being patronized and treated like addicts and denied their medicine. Their you know there's a story about this lady that has breast cancer, and the lady was denied getting any pain medicine after her breast cancer surgery by this doctor. He told her to go home and take some ibuprofen after she just had her breast removed because of this opioid scare deal. I mean, that's what it's coming to. That's really, really sad and jacked up. And this is another reason right here. President Donald Trump reiterated on Tuesday that he won't let the federal government reopen until it gets more than $5 billion to build his wall at the US-Mexico border. And one of the reasons for this demand, Trump said in a speech at the Oval Office, was that the wall would help combat America's opioid epidemic. Our southern border is a pipeline for a vast quantity of legal drugs, including meth, heroin, cocaine, and fentanyl. Trump said every week 300 of our citizens are killed by heroin alone, 90% of which floods across from our southern border. More Americans will die from drugs this year than were killed in the entire Vietnam War. Okay? Do you see this link right here? It's not the prescription drugs, people. It's not the doctors that it's not it's not the doctors that are doing this. It is politicians. It is black market, nefarious drug dealings. It has nothing to do with the doctors. This whole idea that, well, yeah, they might be on heroin now, but they wouldn't be if they didn't get that prescription, to start out with. And that's the reason, because the doctor had them on all these pain pills, and now they're a heroin junkie. Let me tell you something. If that person is an addict, if the pain pills weren't there, it would have been something else, because they're an addict. Being a drug addict is not the drug, it's a mental disorder. It's a genetic disorder. It is a compulsive disorder. It is something traumatic that there are underlying things going on that would bubble up to the surface and cause extreme issues in this person's life, whether the opiates are there or not. Okay, so that whole line is just bullcrap. Okay, I've never seen, and I was in the medical profession for 15 years. I've never seen someone go from having their appendix taken out and getting a prescription for pain medicine, Lortabs or something afterward, and then them becoming a junkie on heroin. I mean, that's just ridiculous. But that's not it. This is it, okay? This is why they're talking all of that. Um, there is a push right now to stop doctors from giving women pain medication after they give childbirth. Yes, that's right. That's how, this has hit the people that need pain medicine, um are feeling this, and are suffering from this, but it's about to get everybody, because every woman that has a child is going to suffer this just ridiculous crap that they're pushing out here with this opiate crisis. If you have a post, well, after you have your baby, your OB gives you some, usually like 10 Percocet 5s or something like that, to have, because you just gave childbirth to go home. You need something for pain. Ain't gonna get it. They're gonna tell you to walk it off, rub some dirt on it, take an aspirin, or chew on a stick, something like that. I mean, that's where we're at. How shitty is that? You just gave birth. You just pushed a watermelon out, something, the size of a golf ball, and they're gonna tell you that no, we can't give you any pain medicine for that, because you'll become a drooling junkie, and you probably overdose and die. So no, can't. You just take some, chew on some ice, take an ibuprofen, you'll be fine. Be fine. What the hell is going on? I'm telling you what's going on. They are missing a large chunk of criminals, and they got to make that up. Got to make that money up. And President Trump wants his damn wall. So he needs something. He needs a reason besides the it, the illegal immigrant thing. He's got to have another reason. That reason is heroin, opiates. It's the opiate crisis. It's the opioid crisis. We're going to fix this opioid epidemic by building that damn wall. That's going to cut off that heroin supply, and it's all going to be fine. There ain't going to be no more dead people then. All we got to do is build this damn wall, and nobody will be on heroin anymore. The opioid epidemic's just going to be fixed then. That's how we're going to do it. We're going to build the wall. It's going to save the heroin addicts. I mean, fucking, what the hell? I'm about to I don't know. I mean, I love this country. I really love this country, and I'm gonna stick here with it. But man, there's some dumbass people living in it. Really dumbass people. The fact that we're allowing all of this to go on, and there's nothing scarier than a well-regulated militia. I'm gonna tell you, and we were given the right to stop things like this from going on. When things got out of hand in legislation, when people were, making cancer patients suffer, people having, their lung removed and sent home with, an antibiotic and no pain medicine because they might get addicted to it and die of a junkie overdose of some heroin, or it mixed with fentanyl down the road. You go and get you go and get in a car wreck and break both your legs, and you get sent home with orders to, you know, whatever, do some, hell, I don't know, pray. So orders to pray the pain away. Just pray the pain away. Take you an aspirin. Pray the pain away. You be all right. We don't want you to become one of them damn heroin addicts and die of overdose. So you just, them broken legs will be just fine. You just pray it on away, okay? All right. Well, that's just ridiculous. The fact that the amount of people that become addicted to opiates after getting a prescription for a procedure is so small that it's ridiculous. The big epidemic is not, I mean, I'm a broken record here, but it's not the doctors. It's the heroin, and it's the fear mongering. I mean, they have to make up the criminal element that is being taken away from them. They have nothing else to lock people up for. They were using marijuana for a long, long time, and they all see it coming down the pipe. Once marijuana is once it's legal, all the marijuana arrests, where are they going to make up that money? How are they going to balance the books when all that's gone? They're going to do it by prescription pain medication. They're going to do it by prescription medication, period, because it's not just pain medication. It's all prescription medication. There's a war on it. If you get arrested or caught with it, you're going to have a felony for every pill that you have on you. It's going to ruin your life. You're going to be same thing as like marijuana charges. Right here, the physician's quandary with opioids, pain versus addiction. Sue Gold, MD, is frustrated with the nation's opioid crisis, but not for the obvious reasons. As a palliative medicine specialist at Penn State College of Medicine in Hershey, Pennsylvania, she sees patients who are struggling with life-threatening illnesses such as advanced cancer. While her mission is pain relief, a flood of new prescribing rules severely limits her options and burdens her staff with extensive administrative hurdles, she says. Drugs are being denied by insurance companies. The pharmacies aren't stocking sufficient quantities of opioids, she says, leaving our staff to go through a lot of paperwork, so there are wait times. Gold describes a breast cancer patient who recently had trouble with a prior authorization policy for a prescription of opioids. After several days of pain and withdrawal symptoms, the patient landed in the emergency room. Concern over the national opioid epidemic has resulted in a crackdown on physician prescribing abilities. Many frontline physicians and clinical leaders feel caught in the middle, acknowledging the national crisis of opioid addiction and wanting to adhere to the new guidelines, but also wanting to decrease patients' pain. The quandary is illustrated in two federal policies issued in March 2016, the same week that the Centers for Disease Control and Prevention launched a national opioid response. A federal advisory committee announced a national pain strategy declaring pain a significant public health problem, okay, and calling for a broad set of solutions, like maybe building a wall. The opioid guidelines have received far more attention, however. Although the CDC's limits on prescription duration and dosage were recommendations, many states turned them into laws that limit physicians' ability to provide opiates for more than a few days. So all of these people that need more opiates, they end up getting them on the street. They get busted. They got felonies. They got money in the bank. Okay, or they get turned on to heroin. Some of the state laws allow flexibility in treating chronic pain patients, but not all. Meanwhile, health plans, pharmacy benefit managers, and pharmacies have jumped in with their own restrictions. With opioid deaths at an all-time high, 115 Americans dying every day from overdoses in 2016. See, this is 2016 numbers. We don't have any current numbers, okay? Or we do, but you've got to go digging for them. And still rising. It's no wonder there's been a stampede toward new policy for prescriptions. They don't want you to know that all of these new policies and all of this stuff they're doing is not working a damn bit. It's still getting worse. The CDC's online resources on opioids notes, we now know that overdoses from prescription opioids are a driving factor in the 16-year increase in opioid overdose deaths, which is bullshit. The amount of prescription opioids sold to pharmacies, hospitals, and doctors' offices nearly quadrupled from 99 to 2010, yet there had not been an overall change in the amount of pain that Americans reported. Deaths from prescription opioids like oxycodone, hydrocodone, and methadone have more than quadrupled since 99. Now, why would that be? In those 10 years or 11 years, why would Americans start taking 4 times the amount of prescription pain medicine, but they didn't have any more pain? Why? Why would that happen like that? That's just it doesn't. I think all of these numbers are bullshit. I think they've all been misconstrued for political propaganda purposes, further crackdown on the American people, and a way to supplement the loss of the marijuana criminal. That's that's my opinion on this whole marijuana thing. I mean, this whole opioid thing. Now, don't get me wrong. Heroin and meth and heroin cut with fentanyl has flooded everywhere. And I think that is by design. I think that probably our government is just like they did with crack cocaine in the 80s. They've just flooded it out there for people, for these type of agendas that they want to pull off the wall. And you know they got to make up a fear drug because they've lost their main one, marijuana. you know um, with the slogan of empowering providers, the CDC rolled out the clinical practice guidelines for primary care physicians rather than specialists. Literature accompanying the guidelines notes that primary care providers account for nearly half of all dispensed opioid prescriptions, and their prescribing rates have increased at high rates compared to other specialties. The guidelines suggest limiting initial opioid prescriptions to 3 days, stating that more than 7 days will rarely be needed, and include exceptions for active cancer, palliative, and end of life care. Well, that's nice of them. The cautions against prescribing more than 90 morphine milligram equivalents per day, claiming there's no evidence that higher doses reduce pain over the long term, and that there's a greater risk of overdose. The potency of opioids is measured by comparing them to equivalent doses of morphine. Just under half of the states have followed with laws that closely track the CDC guidelines. According to the National Conference of State Legislators, most limit initial opioid prescriptions to 7 days, although the limit in Kentucky is 3 days, in Minnesota 4 days, and in New Jersey and North Carolina 5 days. Some states, but not all, include exceptions for chronic pain. Well, that's about the gist of it. And think on these things, people, because something's got to give. It's gotten ridiculous. Thank you.